Thank you very much, Rich. Well, with a focus now on Blue Dog Democrats, has the White House all but given up on getting any kind of Republican support for the health care plan?
Let's ask a member of the Grand Old Party, Congresswoman Marsha Blackburn of Tennessee. Welcome, Representative Blackburn. Good to see you.
Good to be with you. Good to see you.
You know, we talk a lot with you about your position on all of this, and you speak rationally when you talk about, hey, you know what, there could be compromises if anybody listened to us, the GOP. Well, now you've got actually Blue Dog Democrats almost siding with you, saying, let's take a breath, let's hold off. Are you communicating with some of those Democrats to try and get your ideas through?
Yeah, Liz, absolutely we are. You know, there is a reason there is bipartisan opposition to what the President and Speaker Pelosi have brought forward, and that is because we do have good ideas that are on the table that address the issues of cost, of access, of insurance reform that are needed. But what we are doing is using market forces and not taking 17% of the nation's economy and turning it over to the federal government to run. So that is why the bipartisan opposition has held. And the fact that we do have ideas, that people are ready to implement those ideas. I think that the really interesting point this week is going to be what continues to happen with that opposition. How firm does that Democrat opposition to the plan hold? And is the Speaker willing, and is the President willing to say, you know what? America is not ready for nationalized health care, and I'm one of those that hopes that our nation is never ready for government-run or nationalized health care.
Okay.
But we have to go. Yes, go ahead.
No, I just wanted to ask. We started talking with our panel about what we might see come the fall. What kind of gamesmanship and compromise? Say, for example, this is an issue Liz and I have been talking about for weeks now. Say the president was willing to give up his opposition to limiting the amount of money that folks could sue doctors, put a cap on those lawsuits, which are killing doctors and driving up health care costs and tests and everything. If he was willing to give up on that issue, what might Republicans and Blue Dogs be willing to give up in return?
You know, well, and that's an interesting point. Liability reform is important. I don't think you will ever see us give up on setting in place a federally run, government-financed, government-insured, government delivery of health care. That is not what the American people want. And one of the important
But is there something, I'm going to press you on this, Congresswoman, is there anything, if he was willing to give up that, what might you guys be willing to give up on your side?
I can't think of anything that we would give up that would push us toward a nationalized system. Whenever it's been tried, whether it is TennCare that was in Tennessee or the Massachusetts plan or the experiment in Maine, it just hasn't worked. It has not brought costs down. I think what you will see is people saying, look, let's address these issues. Let's drill down on the cost. Let's drill down on the access. Let's work with those who actually do not have access to insurance, to a health insurance product, and address that.
But Representative, you're sounding very intransigent here. We just had the head of the Cleveland Clinic, which is held up as a model of high-quality care but lower costs, on in the last hour. And Dr. Cosgrove, Toby Cosgrove, who's the head of the clinic, said, you can do this, but you have to lay out a bunch of money in the beginning for things like an IT system that then later brings down costs. Do you get that part of it?
Oh, absolutely. And health IT is something that is important. We know that that's important. We know that insurance access for those that actually do not have it, that's important. And that putting those plans in place are going to take some effort, both administratively and some cost for putting the program in place. We accept that has to be addressed. But I don't think you're going to see anyone give in and say, we're going to go for a step that is going to move us to a federalized system. One of the things to keep in mind on this also is we have seen the liberal elites push toward a national run or government run system. You had it with Medicare, with Medicaid, with SCHIP. There have been all of these steps. And we have to realize that we have to win every time this issue comes up. And this is one of the last steps, is putting in place a public option that would be in direct competition with private insurance. We know what happens with that. And that is ground that we're not willing to give on.
Representative, thank you very much. Representative Marsha Blackburn.